Hello guys. Today I am going to talk about healthcare inequality in rural areas. In many rural areas, one issue persists: significant obstacles in accessing essential medical services. This results in poorer health outcomes and increased healthcare costs over time. Key barriers include geographic isolation, limited transportation options, financial constraints, a shortage of healthcare professionals, and the lack of awareness about available services and the importance of preventive care. And that's why I chose healthcare inequality in rural areas as my problem statement. Presently, fixed health clinics offer essential services, yet their reach is limited by their number and location. Community health workers play a crucial role in bridging gaps in care, but their capacity to address all medical needs is constrained. By addressing these challenges with innovative solutions like mobile health clinics and encouraging the development of community engagement, we can make significant strides in reducing healthcare inequalities in rural areas. This project aims to explore these solutions in detail and propose actionable steps to implement them effectively. The social determinants of health include economic stability, social and community context, neighborhood and environment, healthcare, and education. In this image, we can see lots of people in a rural area, getting some medical care and buying medicines. In this image, we can see a small boy getting checked up on by a doctor. Rural healthcare overview. Rural healthcare refers to healthcare services provided to people living in rural, remote, or less densely populated areas. In many countries, rural areas often face significant challenges when it comes to healthcare access, quality, and availability, leading to disparities in health outcomes compared to urban areas. Rural populations are more likely to have limited access to hospitals, clinics, and healthcare professionals, making it harder to timely receive and necessary care. Healthcare for rich is poor. Rich people have higher income, they can buy proper diet, they can maintain proper hygiene, and because those they are less prone to disease. Poor people mostly have lower income, cannot afford to have nutritious diet, do not have the facilities to maintain proper hygiene, so they can fall ill easier. When a rich person is ill, they can go to private hospitals and get immediate support, and they have health insurance to cover hospital bills. But when someone in rural area falls ill, they have to go to government hospitals which have less infrastructure and have longer waiting period, and mostly have no health insurance and have to pay expenses from their pocket. Access to healthcare providers. Rural areas often have fewer healthcare professionals, including doctors, nurses, and specialists. This shortage means that people living in rural regions may have to travel long distances to see a doctor, which can delay care and worsen health conditions. In some cases, there may only be a few doctors available to serve entire countries or regions. Healthcare infrastructure. Rural communities often lack the infrastructure that is readily available in urban areas. Hospitals and clinics in rural areas may be smaller, have fewer resources, and face financial challenges. As a result, they might not offer certain types of care, such as specialized surgeries, advanced diagnostics, or intensive care. Transportation. Transportation is a major barrier in rural areas. In rural regions, public transportation options are often limited, and patients may not have access to reliable vehicles. This can make it difficult to reach medical facilities, especially for elderly individuals or those with chronic conditions who need regular checkups. Higher rate of chronic conditions. People living in rural areas tend to have higher rates of chronic health conditions such as diabetes, heart disease, and obesity. This is partly due to limited access to preventive healthcare services as well as challenges related to lifestyle such as limited availability of healthy food options and recreational facilities. Health literacy and education. Health literacy is the ability to understand and use health information to make informed decisions. Is often lower in rural communities. This can make it harder for rural residents to understand their health needs, manage chronic conditions, and navigate the healthcare system. Why rural healthcare is important? Addressing the healthcare challenges in rural areas is essential to promoting health equity. People living in rural areas deserve the same quality of care as those in urban regions, and ensuring access to healthcare in these areas can lead to better health outcomes and higher quality of life by improving rural healthcare infrastructure and services. We can reduce health disparities and create a healthier population overall. My solution to this problem is with mobile health clinics. Mobile health clinics are traveling doctors' offices that go directly to rural areas where people live. These clinics are set up in vans or buses equipped with all the necessary medical equipment and staffed by the healthcare professionals such as doctors and nurses. They travel to different rural communities on a regular schedule, stopping at designated locations like schools, community centers, or parking lots. Once they arrive, people from the community can come up with the clinic to see a doctor or nurse. They can get checkups, vaccinations, and advice on staying healthy. The clinics may also offer services like screenings for diseases, basic treatment for common health issues, and health education to help people understand how to take care of themselves. Mobile health clinics are important because they bring healthcare directly to people who might otherwise have trouble getting to a doctor's office. They are especially useful for rural areas where there aren't many healthcare facilities nearby. By setting up mobile health clinics, we can make sure that everyone, no matter where they live, has access to medical care they need to stay healthy. This is a rough drawing that is made to my solution. We can see that the mobile health clinic is coming towards a rural health clinic. Thank you.